Hello everyone. I'm making this video to talk about chronic pain medication, the management of chronic pain, and daylight savings time. I'm not a healthcare worker. I don't claim to be a healthcare worker. What I'm sharing today is from my own life and my own experience of being in chronic pain for the past 10 years. I'm making this video so you're able to go to your doctor or pharmacist with perhaps an idea of how you can manage your chronic pain during the hour time difference when daylight savings time comes on and goes off again. For me, I'm using long-lasting pain medication every 12 hours. I've timed this to 2 events in my life. The time I take 1 dose is at 4 p.m. So what's so important about 4 p.m. is that I'm going to the pool about 2 hours later. I need the medication working so I can put the stress and move my legs in the ways it's going to cause healing and do what is best for me. So that pain medication is a means to an end for the purpose of physiotherapy. I need to maintain that schedule. It's worked very well. The other event is 4 a.m. So you may be wondering, why would someone be taking medication at 4 a.m.? It's not logical. It would encourage broken sleep. In my situation and my disability, I need to get out of bed in the nighttime and stretch. That's because of stiffness overtaking my hip and knee joints. The 4 a.m. time works, and it works well. So how do I manage changing my pain medication when the clocks go back an hour in the fall or go forward an hour in the spring? The answer is simple. I use 15-minute increments to adjust the pain medication over 2 days, so the time that I'm taking it returns to the 4 a.m. and 4 p.m. So the first dose in the fall is taken at 3 a.m. and then 3:15 p.m. The next day is taken at 3:30 a.m. and then 3:45 p.m. and then I'm back to the 4 o'clock time where I'm used to taking it. Before I started this technique, I was just grinning and bearing the hour of agony that I was going through and then taking it at 4 a.m. However, with chronic pain, once you start to experience it, it's like chasing the tail of a dog and the flapping it goes through. It takes so much more to get back on track once you've lost control of the pain. So for me, using 15-minute increments works and works well. So what happens when the clocks spring forward? So in the spring months, my AM dose would start at 5 a.m. and then the afternoon dose would be at 4:45 p.m. The following day be 4:30 a.m., 4:15 p.m., and then I'm back at my 4 a.m. time. I realize how debilitating pain is. I didn't get it before my experience now. I do now, and I sincerely feel for anyone who does endure it. I'm going to make another video separate of this to help support people who may be struggling and need to be getting on prescription pain medication. I want to ask you to look for it if you're needing this advice and support. And for those of you who do who do experience chronic pain, I just want to encourage you to know that there are other people that go through it. You know, your family may not understand, your colleagues at work may not understand, but there are people in your life that you meet in passing who do deal with chronic pain. I believe in God. I have for years, even long before my disability became very, very, very serious. And I believe that God's good during the times in our lives when we're hurting and when we need to call out for help and comfort. And I want to let you know that there's a loving God who's there to hear and support and comfort during times that are really challenging. Thank you for the time that you spent with me today. Bye for now.